The first disease that we are going to talk about is hypertension. Hypertension is super common. It's so common that um, I don't know how many, like over 75% of Americans. It's very common amongst older Americans and all over the world. Hypertension is seen basically across the globe. Um, the funny thing is, a whole lot of people have hypertension. They have no idea they have it, and they go about their businesses. And you must have heard someone walking and then slumped or in an activity and then falls down and needs help, or it just could be anything, or someone had stroke or whatever it is. Now, hypertension it's easy to manage, okay? However, if it's left untreated, it can actually cause tremendous damage to end organs. We talk about end organs, we talk about the brain, the heart, the kidneys, and these damages can be, some of them can be irreversible. Some of them can really cause permanent damages, especially when help is not in sight, okay? Now, if you are in a place where the emergency response is really speedy enough, you might get help. But if you're not, now you need to really take care of yourself, okay? That is why we are doing this health awareness. Like I said before, if you have any questions, please do not hesitate to contact me by commenting on this video or reaching Associate Professor Boji by email or text message, or anyhow you can get to him. You can also inbox me directly or write me an email or message me on WhatsApp. Anyhow you can get hold of me. Or if you know somebody that knows me, please don't hesitate. Okay, so like we said, there are basically three types of hypertension. Let's put it that way. We have the primary hypertension, the one we call essential hypertension. That is so common. I will explain that later. We have the secondary hypertension. That is, there is already a problem in the body, then it's that problem now causes hypertension on top of it. We'll talk about that very briefly because it's not common. However, it is something that you should know about. And then we have gestational hypertension that is specific to women of childbearing age during pregnancy. Some of them develop hypertension as well. Now I'm gonna go ahead, for those that have been seeing the Zoom video, I'm gonna go ahead and share some slides with you. And those of us that are going to be seeing the just normal video, that's okay. I can still share the information, okay? All right, let's see how much we share. Is it this one? Okay. So we have some information right here. I'm going to go through them very, very quickly. Because some of the information here are really very technical, which is not what we need right now. But okay. Now, high blood pressure or hypertension depends on what you call it. It says it's a very common disease and a very common cardiovascular disease all over the places, not just in US, it's in Nigeria, it's all over the places. Now, the primary or essential hypertension is defined as the hypertension that starts with no cause. Somebody just unannounced developed high blood pressure, and it represents 90% of all cases. Okay, now blood pressure is when the pressure in the blood vessel increases for any reason, for example, let's say the blood vessel is like a tube, right? It has a lumen, it has an opening inside where blood flows. For any reason, there is a narrowing of this lumen, and the same quantity of blood is coming in, right? It needs force, it needs higher force to be able to go through the narrow lumen. All right, so that's when the blood pressure goes up. Here I have, we have blood pressure. We call it SFIG. I used to measure blood pressure, and there are so many kinds. This is electronic. There are just so many types out there, and so we use this to monitor the blood pressure, to measure the blood pressure. I just wanted to show you something. Oh Lord. Okay, I just wanted to show to describe these numbers here. Now we have what we call systolic and diastolic pressures. That is what I want to explain. You don't need to understand what happens, but the range for systolic, which is higher than the diastolic, it should be higher than the diastolic, is between 90 and 120. That will be considered normal, and the diastolic should be 60 to 80 millimeter mercury. That is what I want to show you. Okay. Let me see, is this good? Okay. So if you can afford this blood pressure measurement kit, this is the electronic one. You have the manual one. Manual one is basically someone else doing it on you, or you doing it on someone else. Okay, this is an example of what the blood pressure will look like. That is 124 over 84. Now, for those on video, I think it's coming out on the other direction. Have to flip it. Now, when you look at this, you see systole, right? Systole. That is the 124, and then you see diastole, that is the 84, and then you see the pulse, that is 71. Now, remember that if you look at this value that we have here, 124 over 84, you will be like, oh, but 84 is over 80 that they suggest here. Now, high blood pressure is not it's not static. It's dynamic, because your blood keeps moving. When you cough, it changes the blood pressure. When you jump up, it changes the blood pressure. When you sleep, it changes the blood pressure. When you exercise, it changes the blood pressure. So it's not like very specific. All right. Okay, so let's go down to what causes blood pressure. There are just the primary blood pressure, high blood pressure. We don't know what really causes it. We just get to know that at a point, the heart begins to pump against certain pressure, and things begin to change, stroke volume and all that. All these things affect the pressure at which the heart pumps. So when there is vasoconstriction is when your vessel narrows for some reason, whatever it is, whether you begin to have a whole lot of cholesterol in your blood, and they are beginning to cluster in your blood vessel, narrowing the lumen, that will cause high blood pressure. Or when there is, you have some of these catecholamines, or a kind of medication that will constrict your blood vessels, that is going to also cause you blood pressure. Yep. So I'm not gonna bug you with all these things, they're not for you to know. Okay, there is something that I want to point out here. There's something we call environmental factors, right? Age. Whenever we start aging, our blood vessels, they begin to thicken, they begin to harden, they begin to lose their flexibility. In that case, the blood will pump with higher force. So there's a tendency that older people will have higher blood pressure because of the effect of age. Now the vessels, they lose their compliance, like they lose their flexibility, and they increase vascular resistance, then causing the heart to pump a whole lot of blood. Now you wondering, why am I mentioning blood pressure and I'm talking about the heart? Now the heart is the organ that pumps blood from your heart to every other part of your body. Now you can measure your pulse here, right? You can measure your pulse on your temporal region. You can measure your pulse on your neck. You can measure your pulse anywhere down to your feet. It's going to be beating at the same time because your heart pumps blood to all these parts of the body at the same time. Now, the heart has to pump your blood to go through these vessels. If anything is blocking them or narrowing the vessels, the heart is going to pump with greater force to overcome this blockage, this narrowing, so it can get blood as far as it needs to get. Another factor that we need to talk about is what we call genetic factors. Now, family history. Listen to this. If your grandfather or grandmother or your father or your mother or your great-great-grandmother or your great-great-grandfather ever had high blood pressure, you are prone to having it. That doesn't mean you're going to develop it. But if you don't watch it, and that is why we're doing what we're doing, if you don't manage it so well, you might develop it. And you even might develop it in a younger age than your parents did or your great-grandparents did, depending. Now, there is this thing about race. African American people have more hypertension than every other race. I don't know why that is, but that's why we are here to tell you to make sure that you check yourself very well. Now, the next big thing that you need to know is about your lifestyle. What do you do? It affects your blood pressure a whole lot. So, if you're drinking alcohol, for example, your blood pressure is going to go up. It's going to go up because alcohol actually is broken down into acetaldehyde, right? That is a kind of a poison to your mitochondria, right? And then it destroys this part of your body and releases other things in your body that your body does not need. Okay, now they change your chemistry, your biochemistry, and that will affect your blood pressure. Alcohol also damages your liver. You don't want to do that to yourself. I don't know how to tell you not to drink. I don't know how to tell you do not drink. Alcohol will increase your blood pressure, but when you cease drinking alcohol, your blood pressure, there is a research has proven that your blood pressure will come down by 7. Let me tell you what that means. I wish I can actually tell you what that means. Now, before your blood pressure will go high to 7, it might take years. But in a month, you bring down your blood pressure by 7 by abstaining from alcohol. You're doing yourself a tremendous good. You're doing yourself an amazing job. So alcohol does you no good. It does you no good. Now, we said we are going to talk about nutrition, but we are going to build it into all these diseases that we're talking about, like high blood pressure. Now, there's this diet called Dietary Approaches to Stop Hypertension, DASH diet. It is rich in fruits and vegetables, low fat, dairy, and fiber. How many vegetables do you eat in a day? How many fruits do you eat in a day? It doesn't matter what. The good thing about these things, as long as they are fresh vegetables, fresh fruits, it doesn't matter which one you're eating. It doesn't really matter. when you're eating it. It matters that you are eating it. Now, this diet can actually bring down your systolic pressure by 5.5 and your diastolic by 3.0. Exercise. I cannot overemphasize on this. Now, when you hear exercise, what comes to your mind? You go running or lifting weight? Not necessarily. You can actually sit in your house and stretch your muscles. Do some push-ups, do some sit-ups, do some crunches, move. If you do these things, actually your heart begins to beat faster, and that begins to regulate your blood pressure. Now, sodium, salt intake. I'm supposed to have a pack of cheese right here to show you what is happening in your life when you're eating some food. When you're eating some foods, please pick it up, read the label. Read the label. What is it saying? How many percentage of salt does it have? If it has a whole lot of salt, when you're cooking it, don't add extra salt. Listen, the truth is that a majority of the food that we eat, they already have salt in them. Now, why would you add extra salt? And the spices that we use, God knows that they contain tremendous amount of salt in them. Now, you're adding more salt to your food if you use spices. If you're someone like me, I cook with natural spices. I do not really use mixed spices or go to the store and buy mix. I do not do that. If I needed to use spices, I use them. I get the fresh spices and I add them to my food. That way I save myself a whole lot of eating salt. Now, why I do that is because I'm prone to having hypertension. I have a family history of hypertension, so I can't risk eating a whole lot of salt. And I will tell you from my own personal experience that it works. It brings down the blood pressure. Now, weight loss is even the highest thing that will bring down your blood pressure. Please, if you're overweight is not like you're eating well. It's not like you have money. It's not a sign that you're wealthy. Overweight is bad for you. I don't know how else to put it. But please lose weight. When you lose weight, your blood pressure. I know people who actually got off medication because they lost weight. All right. If you are older, adult here, please maintain your blood pressure as much as you can. Say less than 140 and over less than 90. Please remember the one I showed you, the 124/80. That is perfect. And this one is not too bad for an adult. This is 143/78. The pulse is 75. It's not too bad. So keep working on maintaining your blood pressure as low as less than 140 and less than 90, less than 130 actually, and less than 80. For younger patients, okay, you can have your blood pressure of 130/80. If you have it less than that, that would be better. The reason is that younger patients are more active and their heart beats faster. They have the tendency of getting their heart to beat faster. Now, if you're 65 years of age and you have diabetes or other cardiovascular diseases, or you have renal problem, please, it is mandatory that your blood pressure is going to be less than 130/80. Now, if it is not on its own, you need help with medication to bring it down that level. The reason is that your heart that's already sick with a cardiovascular disease needs not to have extra work to do pumping blood against high pressure, right? And your kidneys that are already sick, they need blood supply. They don't need anything to stop them. So they don't need the high blood pressure. And if there's anything, diabetes, you don't want to mess with that. Please make sure if you have any of these conditions, if you know someone that have these conditions, please make sure that person's blood pressure is maintained minimum less than 130/80. Okay. Now, for any reason, you begin to work towards reducing your blood pressure, either by diet or by exercise, please, and you start feeling dizzy you want to pass out, you feel like you're going to fall down, please stop. Consult your doctor. Now, I might function at 120/60. You might not do that. Someone might function at 90/60. And I have a friend, she is just 90/60. And if she has 110/70, she'll be like, whoa, that's high. But then someone like me, I am functioning at 120/80 and 130/80. Some other people function normally at 140. So it depends on what works for you. No, we have all these figures, but we still deal with individual patients. All right. Now for your medications, please do not medicate yourself. If you have high blood pressure, do not medicate yourself. Go to your doctor, get your prescription, and go to a real pharmacy. Please go to a pharmacist. Get your drugs, get your prescriptions filled, so that you can ask your pharmacist the effect of the medication, when best to take it. I keep telling people when best to take your high blood pressure medication is when you wake up in the morning. Before you eat anything, take your medication. 30 minutes after that, eat. Now, the reason we do this is you take your medication with water, 1 full glass of water. Before 30 minutes, you want to go and urinate. Now, that helps you wash away whatever it is that you had last night, and it's going to help you. Now, the more you urinate out the water and the salt in your body, the better your treatment, the more effective your treatment is going to be. And then your blood pressure is going to be okay. All right, let's see. Now, complications. What happens when you don't treat your blood pressure? Why are we even talking about this whole thing? Because it can lead to heart failure. It can lead to lethal heart failure. Now, when your heart keeps pumping against high blood pressure, right, in your vessels, you know how you work out your muscles, you begin to have develop muscles, your heart to develop muscle. You develop muscle, you become hypertrophic, you become larger than normal, and that is not good. That is not good for your heart, because it's going to pump like that so much until it can no longer make it, until it fails. We don't want that. Secondly, your kidney. Your kidney. Now your blood vessels that supply blood to your kidneys, they begin to work hard because something is not happening well. Your heart is trying to pump blood, and the blood is not reaching as much as they can, and now it begins to affect your kidney functions. And your nephrons now naturally die with years. Now, if they don't have enough blood supply, they will die even more. Then you can no longer have kidneys that function, and that patient will now have to have kidney failure. Does that sound familiar? Kidney failure, going to dialysis, and no dialysis are not well done. Kidney transplant, if you can get kidneys, the patient might not live any longer. Now the brain. Now, patient can have stroke. And here is the thing about the stroke that is caused by hypertension. It's actually hemorrhagic. The blood vessel normally bursts. Boom! The blood will flow into the brain. And there is no space in the head for fluid to accumulate, for blood to accumulate. Now, it's not just it causes stroke, it also accumulates blood and then displaces brain tissues. Okay, I don't want to go into that, but you don't want that. Please don't leave your high blood pressure alone. Get it treated immediately. Another thing is your eyes. Your eyes. The same thing. Because the blood vessels in the eyes are really small. Any increase in pressure will increase your ocular pressure, intraocular pressure as well, and it can lead to bursting of those vessels, and they will bleed. Okay, you don't want that. And it's very common, and it can lead to blindness. please get your blood pressure treated. Okay, this is an image of hemorrhage in the retina. We don't want that. Okay, let's take this question. Hypertension is usually asymptomatic. Now, that means people have hypertension, they don't know it. They're going around, they don't know it. Maybe you do, maybe someone else does, and they don't know it. So the most common symptom of hypertension is no symptom. But how do you know? Check your blood pressure occasionally. Please, if you can afford this, get one for yourself, get one for your parents or for your grandparents, for your loved ones, for your boss. This is a good birthday gift, good wedding anniversary gift. I don't know how much it's sold, but it's not, even if it's expensive, this is a lifesaver. Now, when you feel a little headache, unusual headache, if you feel, oh, your eyes are becoming sensitive to light or to sound, hey, grab this, check your blood pressure. It doesn't take more than 2 minutes to do. Actually, 1 minute, if you know how to put it on. So you put it on your just take it out. Okay, you see this? It smells good. See that dot? You put it. Pull your cloth, put it on, right? This is supposed to be on your here, right here where your vessel is. So it's going to pick up your heartbeat, your pulse. That's it. Press the on button. I don't want to scare you all with my blood pressure. It might be all because I've been talking. Yeah, it's high. Well, because I've been talking and doing so. Remember I said, what you're doing, when you're doing it, how you're doing it will determine the blood pressure. Okay, let's quickly run to diabetes. I didn't want this video to be more than 30 minutes, but as I look at it, it is becoming more than 30 minutes. Okay, there are 3 types of diabetes. There is type 1, type 2, and gestational, which happens to pregnant women again, like we said the other time. Type 2 is pretty more common, and it's caused by, it happens mostly in adult age, caused by resistance to insulin. Normally the patient has normal insulin at birth, during childhood, during adolescent, during early adulthood, until around like 40 years old, and the body begins to resist insulin, and then the insulin can no longer, insulin like takes away glucose from your blood, right? Insulin can no longer do that because it's no longer accepted, especially in the muscles. And what happens is that since nothing is there to take away this glucose from your bloodstream, the glucose accumulates in your bloodstream. When you measure your blood sugar, it shoots up very high, and it's diabetes. That's not rocket science. Now, type 1 type 1 begins at childhood. You see a lot of babies, a lot of children, like 6 years old, like 10, like 12, like 18, they all begin to have diabetes. Listen, it happens that way. It's because they don't have, for some reasons, they don't have enough insulin, or they don't have, the pancreas is not producing insulin, for some reasons, okay? Mostly some, changes in the body, or yeah. So the problem with diabetes is that the insulin, that is the hormone that takes off takes off glucose from the bloodstream, it's no longer doing its job. So when it's not doing its job, glucose accumulates in the blood, and that causes it. Obesity is a major risk factor in type 2 diabetes. Remember I said type 2 begins later in life, like 40 years of age and above, right? Obesity is a major risk factor. If you're big, if you're fat, please lose weight, your blood pressure will come down. Lose weight, obesity, diabetes will not happen, right? Another thing is low exercise. You're not exercising, you're just sitting down in your car, in your office, at home. You sit down, you watch TV, you watch movies, you don't even exercise. Please exercise. Enroll into a sporting program. Are you smoking? Stop smoking. It increases your risk of getting diabetes, blood pressure, and all that. Alcohol again. Then diet. Are you eating a whole lot of sugar, carbohydrates? Please stop. Okay. Now, sleep duration. It is almost 2 a.m. here. I'm waking up by 5:30 to get ready to go to church. I sing in the choir, so we're supposed to be in church by 6:30 for warm up before 7 o'clock service. I don't have enough sleep. If I continue this way, that is enough to alter my body system. So sleep duration can alter the risk for type 2 diabetes. Please get enough sleep. Please get enough sleep, as much as you can. All right. We've talked about obesity, sedentary lifestyle, elevated blood-free fatty acids, genetic predisposition. Now, if you have diabetes in your family, there is a tendency that you also develop it later in life or even earlier. So once you have a family history, please be conscious of it. I am not saying that you are going to be sick or that's going to happen to you. That's not what I'm saying. What I'm saying is that you're going to be conscious of it. That way, you can actually prevent yourself from, you can break that chain of family disease, all right? You have leptin deficiency. This is when you don't have leptin in your body. That makes you eat a lot. Cytokines from tumor, necrosis factor and all that. Cortisol, please listen to this. If you have a medication you're taking and it contains cortisol or glucocorticoids, please, it can cause you diabetes. You can develop diabetes type 2 diabetes. You can develop type 2 diabetes. Now, stop taking those medications. If you have to, talk to your doctor, talk to your pharmacist, or whosoever that prescribed the medication to you. That's why it's good to get a prescribed medication. If you're taking a medication that is cortisol or that has a high dose of glucocorticoids, please, especially when you're taking it orally, it can cause you type 2 diabetes. You don't want that. So monitor your blood sugar. When was the last time you checked that? When was the last time you checked your blood sugar? Okay, now let's talk about these. Abdominal obesity. If you have big belly, that ain't no good. Please lose weight. High levels of triglycerides. Triglycerides, you get it from eating a whole lot of sweets, sugar, cake, cookies, sweets, ice cream, all these things that contain a whole lot of sugar. Please cut them off, especially when you don't burn them out. Yes, you know me, you know I love to bake, and I eat a whole lot of baked stuff. However, I bake my cake, I bake my cookies, I cut down the sugar in the recipe. That's one thing I do. However, I burn them all out. So if you want to eat, please be ready to burn. Be ready to exercise. If you don't want to exercise, do not eat. I didn't say you should go fasting. Fasting is good for you too. But hey, you can please control what goes into your system. Now I'm gonna share this thing quickly, very, very quickly. This is what will happen to you when you see this thing. Please, please, when you see these things I'm going to show you now, these 3 P's, please run to your doctor. For some reasons, known or unknown, you begin to feel super hungry all the time. Super hungry all the time, that you can eat, you feel like you can eat the whole food by yourself. Now you just ate. Now you're hungry again. Now you're hungry again and you want to eat again. Listen to your body. It's telling you something. That ain't normal. And if you want to urinate, you want to pee, you want to urinate, every time you're going to urinate, like next time you just come out of the bathroom, next time you're going into the bathroom again because you want to urinate, and it's a whole lot of urine. A whole lot of urine. Please check your body. And then you feel thirsty all the time. I carry water with me because I drink. Water is the only thing I drink. I don't drink any other drink. Not even soda. I don't do soda. Okay? So you're still trying to consider why people ask me, how do you maintain your shape? I don't do a whole lot, but I have control over what goes into my mouth. I drink water. Now I drink water because I don't wait to get thirsty before I drink water. That's the best way to drink it. However, if for any reason you are imperiously thirsty, you are drinking water, like you're just unsociably thirsty, you might want to check yourself. And when you drink a whole lot of water, you're going to urinate a whole lot of times, you're going to pee a whole lot of times, and are you eating a lot? These 3 P's are pointing to diabetes. You need to have yourself checked. Okay. Now there are complications of diabetes. It's going to alter your electrolytes. It's going to cause you hypertension. Hypertension is more deadly than hypertension. The reason is that it's easier to bring down blood pressure than it is to push it up. So it can cause a whole lot of infection. Diabetes messes up with your immune system. It messes it up. So you don't want that. Now chronic, we need to discuss this. Chronic complications, your eyes. Now diabetes will deposit, you have a whole lot of glucose in your body, right? Now this glucose is converted to sorbitol. Sorbitol now gets accumulated in your blood vessels. Remember the blood vessels we talked about in hypertension? And also around your nerve. Now those blood vessels will stop feeding your nerves, and your nerves begin to lose their tendency to transmit information to your brain. So someone with diabetes now begins to lose the sense of touch, the sense of pain. That person will no longer feel pain. Okay, that's what happens to the eyes. It leads to blindness. That's what happens to the kidneys. They lose their function, and the patient goes into dialysis or transplantation. Now, when that happens to your finger or your feet, your toes, the person will have pain, will have a wound, and will not know about it. A diabetic patient will have a wound, will not know about it, because the nerve supplying the brain with pain sensation has been damaged by accumulation of sugar, right? Then that person can no longer feel pain. And that person will develop an ulcer like this without even knowing it. And it's eating that person up. And when this kind of ulcer gets infected, it will go into the bloodstream. And the next thing is that they amputate that limb, the leg, they cut it off. It's cut off. Because the infection will be so much that it will go into the brain and into the body and cause sepsis. You don't want that. That one kills faster than losing a leg. But that's how diabetic patient gets to lose their legs. Now, what we tell diabetic patients is, make sure you check your feet every morning. Every morning, wake up, check your feet, make sure there's nothing in there, because they no longer feel pain when it is after a long time they develop diabetes. Please please, please do everything you can to avoid all these diseases. Also, it increases the risk of stroke, heart disease, peripheral arterial diseases, accelerated atherosclerosis with high risk of coronary artery diseases, stroke, the same thing. Okay, now these are the tests that we do. If you want to do a blood sugar test, there are kits, home kits, that are really very small and easy to use. You can have them at home, or you can go to the hospital. They run tests. It's easy, instant. You have your result. Please check your blood sugar. It depends on where you are. I don't want to talk about hemoglobin A1C. If you have a question, you can email me about that. It's really very specific. And how can we prevent type 2 diabetes? We have to cut off those risk factors. If you have obese, please calm down, lose weight, exercise, stop drinking alcohol, stop eating a whole lot of sugar, stop smoking, and please exercise. All right. Glucose is diabetes is very well managed. If you have diabetes, please go to the hospital. They're going to figure out which medication works for you, and when they give you medications, please take it. If you're taking insulin, remember you're supposed to eat either before or after you take your insulin, because insulin that you take is going to go into your blood and take out every glucose in there. So if you don't have a glucose inside replaced, it's going to take out the one you have, and you're going to have hypoglycemic shock. That is very dangerous. If you don't have anybody around you, it may be hard. So please, if you're taking insulin, make sure you always have something sweet around you. Yes, that sounds really weird, but insulin will do its job. Take away all the glucose you have in your blood. So why do we need system in our body, glucose in our body? Because that's where we get our energy, right? Your red blood cells cannot use anything else except glucose, followed by your brain. However, if you're fasting for like 7 days, your brain will begin to use ketone bodies to make its energy, right? That's a different thing altogether. But once you need to have glucose supply to some level in your body every single time. So if you're on insulin, please make sure you have something sweet that contains glucose in your pocket, so that whenever you feel hypoglycemic, you took insulin, you're about to eat, and you get a call and you're distracted and you want to drive your car, please make sure you have glucose in your body, glucose in your purse, in your car, anywhere, so you can put something in your mouth. All right, that will be it for diabetes, and I hope you're enjoying this. This is really a marathon, and I hope it works for you. I just want to very briefly touch on kidney disease. I already mentioned it. High blood pressure kills your kidney, kills it so fast. And because people have hypertension and they don't even know it, it hurts their kidneys without them knowing it. Now, when you find out that you have high blood pressure and you get it really well treated, good. Also, diabetes kills your kidneys, right? See how these things are related. Please have diabetes, get it treated. If you have pre-diabetes, it's not very certain you have diabetes. Please do all those things that we have already listed. If you're smoking, stop. If you're drinking alcohol, stop. If you're eating a whole lot of sugar, stop. If you're overweight, please lose weight. If you're not exercising, please start exercising, and you'll be fine. I've seen people who are on diabetic medications and they had to get off it because they started exercising, they started eating right, they started doing, being active. Okay. Now, kidneys. What kind of medications do you take? Most of these medications go through the liver and they're excreted through the kidneys, right? they have effect on the kidneys. Please mind what medication you take. A lot of them are nephrotoxic. Nephrotoxic in the sense that they kill the kidney. They might help you with what you're taking them for, but then they're going to kill your kidney. Did I mention about cocaine increasing your blood pressure? Oh yes, it does. All these street drugs, please don't take them. They will do you no good. They're going to increase your blood pressure, increase your heart rate. They're going to mess up your brain. They're going to mess up your eyes. They're going to mess up your kidneys. Don't take them. Now, even most common acetaminophen, ibuprofen, all those drugs, please take them on. I know you can buy them over the counter, but make sure before you take them there's a reason for that, because they're going to mess up your liver, mess up your kidneys. You don't want that. Okay? And if you already have a kidney problem, please seek for help. How do you know you have kidney problems? It's easy. When you start having pain when you're urinating, when you start having when you notice that you don't urinate as you used to do before, or your urine begins to smell somehow or comes out cloudy or whatever. It could be an infection. It could be something happening in your kidneys. If anything, you notice that you're drinking more water but you're not urinating as you're supposed to, please seek for help. Okay? The earlier the better. If we find out something going on in your life early enough, we'll be able to help you. All right, I hope I've been able to give you a very, very brief but important information. Now, lastly, before I go, if you're pregnant, pregnancy is something really big. Okay, you have more than one human being sharing a body. Now, you have to really take care of that body. Please, if you start seeing that your feet are swelling, don't take it lightly. Make sure you get help. If you think that your heart is beating slower or anything, don't take it for granted. Get help. So make sure you also check your blood sugar when you're pregnant. Check your blood pressure every time when you're pregnant. You can just walk into a chemist store and ask them to check your blood pressure, or to a hospital, ask them to check, or a nurse station, ask them to check your blood pressure. And then they'll be willing to do that. Don't take it for granted, please. And the only time you see me anywhere, just ask me to check your blood pressure. I always have this, the manual one in my car. I always have this in my house. In the office, we have all these things. So please, these are the things that can save someone's life. Now, not too long ago, I had a friend that had an emergency. So when I got to her, I checked she was breathing, and I had my blood pressure, swig and stethoscope already. So I checked her vitals and they were okay. I knew she was going to be okay. This can save someone's life. If you know how to use this is electronic, you don't need any rocket science to know how to use it. And you suddenly see somebody that falls on the ground, and you put this cuff on that person and measures the blood pressure, and it's reading like 60/40, that person has a problem. Call for help. Please call for help, because that person, if you don't do something, that person may not make it. Please learn what to do and how to do it. Okay? Questions are welcome. Comments are welcome. I am doing this out of love from my heart, and I know Dr. Oboji Kingsley is also sending his love, and we are fighting this battle. This is just the beginning of the great things we're going to do in the group. Please be part of us. Ask us questions, bring topics that you want us to talk about, and we will rightly do justice to it. God bless you all. We love you. Enjoy the rest of the day. Bye-bye.